History's greatest crimes are rarely conceived in the clamor of a battlefield. More often, they are born in the profound silence of a government office. In 1932, the United States Public Health Service arrived in Macon County, Alabama, with a promise for hundreds of impoverished black sharecroppers, free government treatment for a common ailment they called bad blood. But this promise was a lie. The treatment was a placebo, the diagnosis a deception. For the next 40 years, the U.S. government would watch, document, and actively ensure these men were never cured of the real disease they carried: syphilis. They were not patients. They were unwitting subjects in a mortal experiment, their suffering meticulously recorded for science. This is the story of a lie that persisted for a generation, a betrayal hidden in plain sight, and a devastating medical conspiracy. How could a nation dedicated to healing orchestrate an atrocity of such quiet, calculated cruelty? The year was 1932. In the suffocating grip of the Great Depression, the black sharecroppers of Macon County, Alabama, were forgotten men. For them, poverty was a birthright and health care a distant luxury. It was into this world that the United States Public Health Service, the PHS, arrived. The initial project, funded by the philanthropic Rosenwald Fund, was a 6-month survey to assess the catastrophic spread of syphilis and offer treatment. But when the stock market crash evaporated the funding, the study's architects faced a choice. They could abandon the project, or they could transform it. A man named Dr. Raymond H. Vonderlehr, whose ambition far outstripped his conscience, saw an unprecedented opportunity: a long-term study of untreated syphilis in the Negro male. In the cold calculus of the PHS, the opportunity for scientific observation outweighed the duty to heal. The objective shifted. They sought 600 men, 399 with syphilis and 201 without, to serve as a control group. The men were promised free exams, hot meals, and a burial stipend to ensure they would not be laid to rest in a pauper's grave. In return, they had to trust the government doctors. To secure that trust, the PHS weaponized a local folk term: bad blood. In the local vernacular, it was a catch-all for fatigue, anemia, and other ailments. PHS officials seized upon this ambiguity, telling the men they were being treated for their bad blood. It was a perfect deception, a lie cloaked in the familiar cadence of the truth. To deliver this falsehood, they needed a trusted face. They found it in Eunice Rivers, a black public health nurse from the community. She was the project's indispensable linchpin. For 40 years, Nurse Rivers drove the dusty back roads, gathering the men. She knew their families, dispensed placebos like aspirin and iron tonics, and provided the comforting presence that ensured their compliance. Her role is a paradox. She was an indispensable cog in a machine of cruelty, yet she also provided the only consistent medical contact these men ever knew. What do you think? Was she a complicit perpetrator, a victim of the system herself, or something more complicated? Let us know your thoughts in the comments below. She was the human lubricant for the machinery of deception. In 1936, the study crossed its Rubicon. Researchers, wanting to track the neurological ravages of neurosyphilis, needed cerebrospinal fluid. To get it, they sent the men a letter on official government letterhead, a masterpiece of malevolent persuasion. It announced a, quote, "last chance for special free treatment." For men desperate for a cure, these words were a deliverance. They lined up, believing they were receiving a miracle, only to be subjected to an agonizingly painful spinal tap, performed without anesthesia. This was not a treatment. It was a non-therapeutic data extraction. The sin was no longer one of omission, of simply watching men suffer. It was now a sin of commission, of inflicting pain based on a calculated written falsehood. The study's most profound betrayal was yet to come. During World War II, medicine made a quantum leap with the mass production of penicillin, a wonder drug that could cure syphilis. For the men of the Tuskegee study, this should have been a deliverance. Instead, it sealed their fate. For the PHS, a cure was a bureaucratic problem. To introduce penicillin would be to contaminate the experiment and ruin the data. Dr. John R. Heller, chief of the PHS's Venereal Disease Division, made the conscious, documented decision that the men of Macon County would not be cured. They initiated a multi-pronged conspiracy of concealment, distributing lists of the subjects, names to local physicians, and the Alabama Health Department, with explicit instructions to deny them treatment. The deception reached its zenith when dozens of men from the study were drafted into the armed forces. Army regulations mandated treatment with penicillin. But the PHS intervened, contacting the local draft board to have the men excluded from service, ensuring they returned to Macon County uncured, denied the right to serve their country, and the cure that service would have provided. For nearly 3 more decades, the study persisted, a quiet atrocity unfolding in plain sight. Men who had been healthy laborers stumbled, their eyesight dimming. Others descended into dementia or died agonizing deaths from cardiovascular syphilis. All the while, the study's findings were published in respected medical journals, its existence an open secret within a community that chose not to see. The unraveling began not with a high-ranking official, but with the troubled conscience of a low-level employee. In 1966, Peter Buxtun, a 27-year-old PHS social worker, overheard colleagues discussing the study. Horrified, he located the files and wrote a formal letter of protest, calling the study a moral abomination. His concerns were managed, not addressed. The PHS convened a panel of insiders who concluded the study was too valuable to stop. It should continue, they decreed, until every man had died and been autopsied. Disgusted, Buxtun resigned, but he never forgot. In 1972, Buxtun confided in a reporter for the Associated Press, who passed the tip to a formidable investigative journalist named Jean Heller. Working from Buxton's lead, Heller began her own excavation. In the PHS archives, she found the smoking gun, internal memos from the 1940s and 50s detailing the conspiracy to deny penicillin and collude with the draft board. This was not neglect. It was a coordinated, systematic program to ensure syphilis did its worst. On July 25, 1972, Heller's story appeared on the front page of the New York Times. The 40-year lie collapsed overnight. The study was immediately terminated. In the ensuing firestorm, Senator Edward Kennedy convened congressional hearings. One by one, the study's architects testified, showing little remorse and arguing their research was a, quote, product of its time. In response, the government's ad hoc advisory panel declared the experiment ethically unjustified from its inception. This finding led to the Belmont Report, the document that became the bedrock of modern American bioethics, establishing the principles of informed consent, beneficence, and justice for all human subject research. Civil rights attorney Fred D. Gray filed a $1.8 billion class action lawsuit, resulting in a $10 million settlement that provided small payments and, most importantly, lifelong medical care for the survivors and their families. It was not until May 16, 1997, that the nation offered a formal apology. In the White House, President Bill Clinton stood before 5 of the remaining survivors. "What the United States government did was shameful," he said, "and I am sorry, but an apology cannot erase a legacy of mistrust." The ghost of Tuskegee still haunts the American medical establishment, manifesting in a justified suspicion that creates devastating health disparities to this day. The most terrifying fact is that the study was never a secret. It was published in peer-reviewed journals for decades. An entire professional class saw the data, understood what it meant, and chose to remain silent. The study is over, but the story of Tuskegee isn't. Its ghost, a legacy of justified mistrust, still shapes medicine today. Understanding these hidden histories is the only way to begin healing the wounds they left behind. Thank you for joining us on this investigation. If you agree that bringing these difficult truths to light is essential work, the simplest way to support us is by liking this video and subscribing. Our search for the truth is never over. Click the notification bell to join us for our next exploration of a chapter of history that must never be forgotten.